Last year came a very interesting study from the study of collegiate mental health. This is actually a one-man operation from Penn State. The nice thing about this was the first study that looked at the kids who are actually receiving treatment. These are students who are receiving treatment. This study was facilitated by the fact that the group of colleges and universities that participate use a program called Titanium, which is really great. And all it means is that it's a database that allows you to enter all kinds of stuff. It's an electronic health record. So being able to use that gave them a very broad sample across the country. And they had a 7-item counseling center assessment that were used in all of the centers. And you can see that nearly 20% had some counseling before college, 10% had taken medication before college, 5% had experienced psychiatric hospitalization, 2% received some sort of drug and alcohol treatment, 11% with non-suicidal self-injury, 11% seriously considered suicide before college, and 7% of the patients report strong fears of losing control and acting violently. It's the first study that ever asked about fear of losing one's sense of control when it came to aggressive or hostile impulses. All right, and they had some more to say. Now here's the good news. Psychotherapy outcomes for depressed students who in fact did get treatment showed a significant improvement. It works. We know it works. But you got to get into the counseling center for it to help. 30% of the veterans reported experiencing some sort that had military-based trauma. And I want to tell you about this because you see, we, at least at Wright State, are seeing more and more of the young veterans coming from the Middle East. They're returning. They have some unique issues. They don't socialize or get integrated very well with other students. They see themselves as being very different. They are much higher risk for PTSD and substance abuse. And I think it's going to be a real challenge in the next 5 to 10 years. The VA has already done a rotten job in taking care of these vets. We know that. And the suicide rates are off the wall. But when these people come to the college campus, we're going to have some better programs than currently are available to help this group of returning veterans. So watch that. I think it's going to be a major issue in the next decade. So as I mentioned to you, they're more likely to have substance abuse, a history of self-harm, suicidal ideation, suicide attempt, thoughts of harming others, and as you can see, anxiety, depression, and academic distress because they haven't been, for example, in the classroom for some time. Those with academic distress had higher incident of unwanted sexual contact and were more likely to be international or transfer students. The last 2 points let you know that probably this has a lot to do with the vulnerability experienced, particularly with the use of substances.